there are there are quite a few different blood tests that can be run to measure inflammation levels in the body and those sorts of things. The problem is that those tests for inflammation are non-specific, meaning if you are being tested for rheumatoid arthritis at the same time that you have a sinus infection, it's going to come back quite elevated and might indicate something other than what it is. So blood tests are a bit difficult to deal with RA. There is something in the blood called rheumatoid factor, and that is a bit more specific, but still pretty ambiguous as far as what it means. And there are so many patients who do not have rheumatoid factor, but still have the disease. So I would say the blood tests are the most frustrating part of diagnosis, because sometimes they don't fully explain what's going on. Another test that can typically be done is looking at some of the joints through an MRI or a CT scan, sometimes even just an X-ray to look at some of those deformities. But I think the most important thing for me has been finding a doctor who treats the physical symptoms that are seen when you present in the office, whether that's a low-grade fever or joint swelling or joint redness. Some of those things can't show up on imaging, and some of those things don't show up in the blood. So it's really important to have a partnership with someone who is treating what they can see physically and treating you based on what your quality of life is like. So I would say, I guess there are also surgeries and those types of things that can sometimes be used diagnostically, especially if there's a joint that's particularly swollen and they aspirate it or take out some of the fluid. It's usually inflamed synovial fluid or synovial tissue that they end up removing. And sometimes that can confirm an inflammatory diagnosis as well. But there are a lot of, I would say, different ways to diagnose it. And some of them aren't foolproof, that's for sure.